The focused ultrasound ablation for recurrent pelvic ovarian cancer.
Thank you for providing me this opportunity to share with you the focused ultrasound ablation of pelvic recurrent ovarian cancer after drug resistance. Patient, 56 years old. Chief complaint over 3 years after ovarian cancer. Surgery pelvic recurrence was found for over 3 months. It is diagnosed as a cyst cancer. After repeated chemotherapy, because of the recurrence and enlargement of the cancer, the following up therapy was refused, and the doctor treating his illness has recommended our hospital for further treatment. And the present illness, there is pain in the abdominal parts. There is an increase of the CA125 of 1,465, and we find that there is absence of uterus and bilateral adlex after operation, cystic solid signal mass shadow on the left side of the pelvic cavity. This is MRI. There is a cyst mass on the left side of the pelvic cavity, 5 centimeters. There is a transfer of the mass. And as for the treatment of the advanced gynecological cancers or other tumors, at present, this is a huge challenge, a great challenge, especially for the metastatic tumors. There will be the resistance to the drugs. So, because of the transfer of the tumors, there will be adhesion and some side effects, and the quality of life of the patients is severely reduced due to the impact of the drug resistance after reoperation, radiotherapy, and chemotherapy. So the quality of life is a key factor to be considered in our treatment. And our goal is to palliation instead of cure. And the minimally invasive medical approaches, there are scarce literature. And you can see this is tumors on ultrasound. This is a scale of the grayscale changes after the surgery or treatment. 200 watt, 80 seconds of treatment time. 120 seconds of sonication in the pelvic cavity. So I told the patient the treatment will be taken stage by stage. 80 seconds of the sonication time. After the treatment, the patient felt satisfactory to the treatment. The patient felt well. The pain disappeared completely. He felt everything come back to normality. Half a year later, the patient required the treatment again. We can see there is a mass on the left side of the pelvic cavity. So we have conducted a HIFU treatment on this part on the targeted tissue. So a brief summary for the treatment of this kind of case. We should be inconsistent with the basic principle of unresectable tumor reduction. It is safe and feasible, and it is also reflect the local control effect, but it is not feasible for all the cases. It is a bright star for local treatment of great significance for future research. Thank you.